Why I help moms breastfeed is because it's what makes us feminine. It's the most feminine thing that we can do, because our bodies are made to grow babies and to give birth and to breastfeed. And this is why Creator made us women. And when moms and babies fall in love during breastfeeding, it can change a mom's perspective about life. She can feel important. She can feel that she has value. I would suggest moms breastfeed exclusively for 6 months, because that's about the only time in the baby's life that you're going to be the #1 person in their life. You're going to be there for the nutritional benefit. You're going to be there for the immunological benefit. You're going to be there for the mental health benefit, for the comfort and the love. When we breastfeed our babies, the babies know where their center is. They know where their soft and their safe spot is. And we can't tell moms to stop that. So for 6 months, that mom is the #1 person in that baby's life. Creator said women grow the babies. Creator said women are in charge of the food, and Creator gave women the breast. That's why we have breasts, is to feed our young. Now, our milk that we make is tailor-made to what that baby needs. So the milk's going to be different on day 1, or the colostrum is going to be different day 1 than it is on day 3 when the mature milk starts coming in. And that's different than the milk that's going to be there on day 10. And it's going to be different than in month 4 when they start putting things in their mouths and their immune system needs an extra boost. So nursing to 2 years, it does provide, I guess the standard answer would be immunological benefits and nutritional benefits. And it's more than just the love. The immune benefits are really important, because when they're at 2, a lot of kids are in daycare, or they're getting out to more play groups, so they're getting exposed to a lot more germs. So babies need that nutritional boost that they will never get from formula. But it's worth it. It's worth every moment that you're lacking sleep. It's worth every moment when that baby's looking at in your eyes and the milk's dripping out of their mouths. It takes a lot of dedication, but it's worth it. Moms and babies need to have that attachment. They need to have that bond. They need to have that love with each other. When babies are born, like the first hour or longer, they should be on that mom's chest. Babies should not be moved at all until that baby has their first breastfeed. Why? That's what they're made to do. Babies are given this gift from the Creator. So when they're born, they know how to get to their mom's breast and to breastfeed, and nobody has to do anything except make sure that baby's warm. It's really important to get prenatal information about breastfeeding, so you know what struggles that may happen in the first couple days, so you're prepared for it. And what's going to be happening at the first week are going through a growth spurt. And if you don't know what growth spurt is, look in this website, because there's lots of information here for Indigenous families that will explain to you what a growth spurt is, so you know what your baby's going through is normal. That yes, you do have enough milk, the baby's just giving it a kick and upping your milk supply. It's really important to get breastfeeding information, so you can see that there's different types of latches. There's not just one way to latch and position a baby. It's all informed choice. So you latch the baby one way. If that doesn't work, you latch the baby another way and see if that works better. So be sure on this website to check out what to expect the first few days, how the breast makes milk, and what to expect the first week of breastfeeding, and how the baby latches, suckles, and drinks, because knowing the difference between a suckle and a drink is very important.